Now let's talk about Mary again. We'll fill out a cognitive conceptualization diagram, or CCD, on her. You'll find Mary's diagram and a blank diagram in the course manual. If you haven't filled out a CCD before, you would benefit from taking one of our more basic online courses, or reading Cognitive Behavior Therapy Basics and Beyond, or Cognitive Therapy for Challenging Problems. First, we'll quickly review the diagram itself. You'll see that the bottom of the diagram shows the cognitive model in 3 situations. You will choose situations which illustrate typical automatic thoughts of the client. If there is more than one consistent theme in the automatic thoughts, make sure to include situations whose thoughts are associated with each theme. The top of the diagram helps explain why clients have certain recurrent themes in their thinking, and how they typically cope with triggers and the activation of their core beliefs. Their relevant lifetime experiences help us understand why clients have certain core beliefs. The coping strategies help us understand why clients have patterns of dysfunctional behavior. The intermediate beliefs, especially when they're in the form of conditional assumptions, help us understand the connection between the core beliefs and the coping strategies. To identify core beliefs, we often ask clients for the meaning of their automatic thoughts. That's why the meaning box is below the automatic thought box. It would be more correct, though, to place the core belief box below the situation. The core belief influences the client's automatic thoughts about that situation. The CCD is primarily used between sessions to help therapists see important patterns in the sometimes overwhelming amount of information that clients provide. We usually don't bring a CCD to session. It's just too complicated for most clients to benefit from it. Instead, we tend to draw simplified diagrams to help clients understand the cognitive model and to explain why they tend to think, feel, and behave in characteristic ways. If you haven't already, take a look at Mary's CCD in the course manual. Do you see how the different elements of the conceptualization fit together? Now I'd like you to fill out a CCD on your personality disorder client.